Hi guys, so today I'm going to talk about some medications that are commonly used and their effect on sleep. Okay, so a lot of people take medications without knowing that these impact on their sleep by causing symptoms of sleep apnea or by even making it difficult for them to fall asleep. Sometimes they can cause other sleep disorders or I say exacerbate other sleep disorders like restless leg syndrome. So I'm going to start with the first medication. The first medication I want to talk about is antidepressants. Now, this is a very common medication. A lot of people, and I'm talking about mostly SSRIs, most people are on antidepressants, but are not sure what it's doing to their sleep. So the first thing you want to know about antidepressants is that it decreases your REM sleep. Now, there are two main stages of sleep. You have the REM sleep and the non-REM sleep. The REM stage of sleep is that stage where we dream a lot. And so SSRIs or antidepressants in general will decrease the REM sleep or even make it longer for REM to appear. And this is very crucial like in patients that have disorders like narcolepsy and who we should expect to see early onset REM. And this then drowns out that from happening. The next thing that antidepressants can cause is that they can exacerbate restless leg syndrome. Now, currently, all antidepressants will do this except one, and that one is bupropion. And so, if I have a patient who has severe RLS or restless leg syndrome, I always recommend for the prescribing provider of the SSRI/antidepressant to try out bupropion. Unfortunately, bupropion does not work for a lot of patients, but it's just good for you to know that that's a good place to look into if you have a patient or if you're a person dealing with significant stress from restless leg syndrome. Now, antidepressants at a low dose have been used by some people to help insomnia. So it can also help you fall asleep quickly if you're dealing with insomnia. And I see that being prescribed a lot by physicians.